Hello, everyone. I'm Ryan Mackman, and I'm a business consultant with Salient Healthcare. I want to welcome you all today to today's webinar about transitional care management. Just a few items of note before I go ahead and get started. I want to inform everyone that this webinar is being recorded, so you will certainly have the opportunity to rewatch the session, and you can even share it with colleagues if you want. Salient Healthcare is going to email you a link of the recording and the slides within just a matter of a few days following this presentation. Also, during the webinar, you should be able to submit questions to the other presenters and myself using your attendee control panel at any time, and we'll go ahead and answer as many of those as possible during our Q&A session towards the end. Just keep in mind those questions are also being recorded, so even if we're unable to get to yours during our allotted time, we'll make sure to follow up and answer that via email. Now, presenting with me this afternoon, we have Stephanie Rotolo, who is our business consultant, and we also have Maria Nicole, who's our senior business consultant. And this, much like many of our previous webinars, has been put together based on our combined experiences. Now, with regards to transitional care management, what we've discovered is that a lot of ACOs are either completely missing out on TCMs, or they think they're doing proper TCMs, but they're just billing for an E&M visit. So in either case, it's a real opportunity for improvement in quality of care, in decreasing readmissions, and an opportunity to increase Medicare fee-for-service reimbursements. This webinar is going to teach you just how important that a transitional care management visit is to ensure better outcomes for patient care, and also the financial benefits of doing so. All right, now I'm going to dive into my analogy. I know for those of you that have been on the prior webinars, this is quickly becoming my thing, but I really think it helps to hammer these points home. So what would you think of when someone's going through a transition of care? Maybe handing them off? So in a sense, it's kind of like a relay race. Now, using this picture, how do these two track athletes help my University of Florida Gators win their race? Each runner has to successfully finish his or her lap and then hand the baton off to the next teammate so that they can then take over. And should either runner drop their baton, the team would then be considered out of the race, all just because of the small mistake of a poor handoff. So in that instance, it's just one poor transition is all it takes to lose. And that's why, and I can honestly say this as an alumnus that I've watched some of UF's track practices back when I was still a student, they actually practice just handing off the baton under duress to make sure that it's done correctly. It's a really basic drill, but it requires continuous repetition to get it right. So in a way, transitional care management is really similar. If you drop the baton, or in this case, the transition of the patient, then you've got a much higher risk of that patient having a readmission. Ensuring that your patient receives the highest quality of care when leaving an inpatient facility, an observation encounter, or even a skilled nursing facility means that you're making sure there's a successful handoff between the discharging facility and the patient's primary care provider. Okay, so let's dive into the real problem at hand that created the need for transitional care management in the first place. I've got a few numbers to begin with, and according to the Agency for Healthcare Research and Quality, the US healthcare system spent $41.3 billion in 2011 to treat patients that were readmitted within 30 days of discharge across all payers. Now, of the Medicare population, costs exceeded $24 billion. Over a quarter of those Medicare patient hospital readmissions were potentially preventable. And that directly led to the hospital readmissions reductions program by CMS. Now, that HRRP program is a Medicare value-based purchasing program. It reduces reimbursements to hospitals with excessive readmissions following 6 conditions and procedure-specific 30-day risk standardized unplanned readmissions. Based on a recent MedPAC study, by 2016, the HRRP program had succeeded in its initial goal of reducing readmissions, which resulted in a net savings to the Medicare program of over $2 billion. Now, I know that some of this financial information can be shocking, but it highlights the true why there needs to be a greater use of TCMs. Regularly performing TCMs prevents hospital readmissions, it lowers costs, and it improves the quality of care. Overall, your patient outcomes increase dramatically. In fact, when I'm dealing with my clients, I tell them TCMs are really as close to a no-brainer as it gets. On this next slide, I've got 3 graphs for you that depict 30-day readmission rates by outpatient follow-up status. On the left side, you're looking at patients with no chronic conditions. The center graph is showing patients with a single chronic condition, and the right graph is showing patients with multiple chronic conditions. When you take a look at those trend lines, and you see that the bottom key is indicating that blue lines show patients who did receive a follow-up visit, and the orange lines are showing patients that did not receive a follow-up visit, you'll see in every single situation, it's blatantly obvious that follow-up visits, or in this case, TCM visits, reduced the readmission rates. Now, I don't think this takes anyone by surprise, because anytime I talk to providers and ACO executives, they all want to reduce their readmission rates, and they know they need to keep tabs on the patients. But what exactly constitutes a TCM to make sure that follow-up visits are done properly? Now, by definition, a transitional care management visit addresses the handoff period between the inpatient and community setting. So now my prior analogy comes back into play, right? After hospitalization or other inpatient facility stay, the patient may be dealing with a medical crisis, a new diagnosis, or maybe a change in medication therapy. And the goal with TCMs is to then improve care coordination and close gaps in care, which is ultimately going to reduce your hospital readmissions. There's a lot of intricacy regarding TCMs. And what I'm going to do now is my own handoff to Maria, and she's going to talk about the many other benefits of performing TCMs. Maria?
Thanks, Ryan. Everybody benefits when ACOs implement the TCM initiative because patients get appropriate quality care. You have providers that are improving their relationship with patients. And when you implement a TCM initiative, it leads to improved care coordination, care gap closure, and reduced readmissions. And all of this leads to cost savings. On my list here of patients, medical practices, and ACOs. And we'll start with patients because patients should always come first. Transitional care management visits have been proven to be an effective method of reducing unnecessary and avoidable readmissions. TCM's visits help to build the patient-physician relationship and close gaps in care for a patient during a time of transition and vulnerability. Following up with the patient within 2 days of discharge helps identify any immediate gaps in care. So, for example, it's an opportunity to ensure that the patient has everything they need, such as their medications. Additionally, it's important to make sure that the patient is reoriented back into the home setting. If they're supposed to receive home health services or require durable medical equipment, make sure that there's no gaps in those services. And telehealth visits have significantly expanded access to care for patients, especially in the time of the pandemic. Many patients that might not have transportation services, but with a telehealth visit, they can still get an effective TCM. So let's take a look at medical practices. By supporting the patient during a time of the transition, the primary care providers are able to strengthen the patient-provider relationship. And this allows them to be available for the patient when the patient needs them the most. With COVID-19, we've seen a dramatic increase in telehealth services. Providers may perform the TCM through telehealth due to the increased reimbursement. Telehealth allows the patient to get access to their primary care provider, while the primary care providers receive additional fee-for-service revenue. I'm sure we're going to see a significant increase in telehealth services used to perform TCMs in the coming months. And finally, let's take a look at the ACO. In consulting with a lot of ACOs, the healthcare consultants and I frequently find that this is one of the earliest and largest opportunities to reduce spend in reducing the avoidable readmissions. In an ACO with over 10,000 beneficiaries, millions of dollars can be saved just by focusing on this one area of need. And based on the data that Ryan shared with us earlier, readmissions contribute to a large portion of spend. An effective TCM initiative can significantly reduce these readmissions to drive savings. So let's take a deeper dive into the fee-for-service opportunity that TCMs present for practices. We often hear that practices are billing for the office visit instead of the TCM. On this graph, we're comparing a 7-day TCM visit with a level 5 office visit. On the left, we see the reimbursement of the 7-day visit, which ranges from $226 to $346 depending on the geography. On the right, we see the ranges for the office visit, ranging from $136 to $210, again, depending on geography. Now, these are the 2020 CMS rates. On average, the TCM visit will reimburse $90 more than the office visit for about the same amount of time spent by the PCP. That is a significant increase in fee-for-service revenue when evaluated across the entire practice annually. You can also use the Salient solution to identify the same information for your practice. Here we have demo data for which we identify the costs associated with the office visit on the CHOP chart with an average reimbursement of $65. On the bottom chart, you have the 2 TCM codes and their respective reimbursements. The average payment for these 2 codes based on annual billing of both of these procedures is $159. That is a significant amount of additional fee-for-service revenue that a practice can generate. I'm now going to hand it off to Stephanie to talk about which patients are eligible for a TCM.
Thanks, Maria. The patients that are going to be eligible for a TCM visit must be in a state of transition, which means that they have been discharged from one of these 3 settings here: the hospital, a skilled nursing facility, or an observation. ER isn't listed here, and that's because being discharged from the ER doesn't actually qualify a patient for a TCM visit, but we still recommend prompt follow-up with these patients because they often need more tests and ongoing management of their illness to keep from getting sicker. Now, not only must you be discharged from one of the settings that I had just mentioned, but you also need to be returned to a home setting. Essentially, the TCM allows the provider to support the patient during this transition as they may not be able to complete those everyday activities the way that they could before. Maybe they need help getting around the house, so a walker's in order, or maybe the patient requires oxygen in the home, so equipment should be set up. Let's go ahead and take a look at some of the things that the TCM should include. Transitional care management is more than just a visit. First, patients who have had a discharge need to be contacted via telephone, email, or face-to-face within 2 days. This means that it's really important that the office gets notified that the patient has been discharged so that they can contact the patient and get them scheduled. To accommodate this type of immediate need, providers want to consider hiring additional resources as well as reviewing their scheduling process to ensure some open slots are available for same-day and TCM appointments. Once the patient has been scheduled, there are tasks that can be completed outside of the face-to-face visit. Providers can review a patient's test results and treatments. They can contact other providers who will be caring for the beneficiary and assist in scheduling any follow-up visits. And last, they can help with updating any care plans for the beneficiary. The face-to-face visit needs to occur within 14 days, but ideally you want it within 7. This visit needs to include several components: diagnosis education for the beneficiary, review of discharge notes, treatment regimen, and any referrals with the patient, and finally, medication reconciliation. This piece here is really important, and that's because it allows the provider to educate on appropriate dosing and instructions, address any dosing errors or medication duplications. It helps prevent adverse drug interaction and alleviates discrepancies between hospital and drugstore formulas that may or may not be covered under the patient's insurance. When patients are in the hospital has their own set of formularies, but the patient's insurance may not cover the drug. So this is an opportunity for the provider to find the patient a drug that is both effective and covered under the patient's insurance. There are 2 types of TCMs that can be billed for. The first is a TCM that requires moderate medical decision making, and it typically happens within 14 days of discharge. The second is a TCM that requires high medical decision making, and this should be completed within 7. Because TCMs have proven to be so successful at reducing readmissions, cost, mortality rates, and increasing patient satisfaction, CMS is actually increasing reimbursements for these services and actively removing obstacles preventing providers from billing them. Both of the TCM codes here are available as a telehealth service, so providers won't have to sacrifice any of these visits due to the current pandemic. I'm going to go ahead and hand this off to Maria now so that she can walk us through an example of a TCM workflow.
So Stephanie just reviewed a lot of really great information, but it may be overwhelming to try to put it together into how this is going to look in your practice. We're now going to take a look at a sample workflow that one of our practices uses to help make this process a bit more manageable. And remember, while this may seem like a lot of steps, the TCM involves a team-based approach. So the process does not require a significant amount of time invested by the PCP. First, you'll want to identify that the patient has been discharged from the SNF, the hospital, or the observation stay. We're going to take a look at a bit more on how to do that on the next slide. Next, the RN or the MA will want to reach out to the patient to determine whether this person needs to come in for the TCM. Since many practices have limited appointment capacity, you'll want to prioritize the patients that are likely to be readmitted. This may include patients that have multiple chronic conditions, patients that are taking multiple medications, and patients that have been discharged from a skilled nursing facility. You'll want to check in with the patient to ensure they have everything that they need to be successful. Have the patient teach back what their discharge instructions were. And it's not enough to simply ask, "Do you understand your discharge instructions?" In many cases, the patient may be just too embarrassed to say no. Remember to do a mini medication reconciliation. A lot of medication errors happen when a patient changes care settings. Inquire whether they've picked up their new medications. And if the patient is a good TCM candidate, schedule them for the visit. When the patient comes in for the TCM, the RN and the PCP will render the face-to-face services that Stephanie had discussed. Remember to evaluate the patient on any red flags that may put them at risk for the readmission. Be sure to follow up with the patient after their visit to ensure that they're still doing well. And be sure to bill for the TCM for all of the hard work that your practice has done. And also, here's an important tip. Practices will want to review any patients that missed their TCM appointment and follow up with them. Patients that actually missed the TCM because they were really feeling too ill to come in and are likely to be readmitted back to the hospital. In order to complete the TCM, the practice needs to become aware that the patient has been discharged from the hospital, the SNF, or the observation stay back to their community setting. First, you'll want to identify the top facilities that your patients are admitted to. It's recommended to begin the initiative in one care setting before expanding the initiative to avoid overwhelming the care team. Once you've identified the top facilities where you're likely to receive the data from, determine whether they're connected to a health information exchange. This is one of the easiest ways to receive notifications regarding which patients have been admitted and discharged. The availability of data from the HIE will vary significantly by state. Some states don't have HIEs, while other states have several. The type of data that's available is also going to vary. So, for example, some HIEs are connected to hospitals and skilled nursing facilities, while others are only connected to a few inpatient facilities. Please note that if a state HIE is not available, there are also for-profit companies that can provide this data. And if the facility is not connected to an HIE or a vendor, they may need to reach out to them to have a more manual process, such as a secure fax or email notification process. Providers that round within the hospital may also have access to the hospital's electronic health records, which can be used to track patient admissions and discharges. So even if you have access to all of this data, you may potentially need a technology partner to help you create actionable work lists for your practice. I'm now going to hand it off to Ryan to talk a little bit more about tracking the success of your TCM initiative.
Okay, thank you, Maria. And what I'm going to do now is I'm going to change my screen over from the slideshow to our Salient Healthcare dashboards, which you should be able to see. Now, I want you to keep in mind that this is a demo set, so we have no PHI being disclosed as I go through this particular segment of the demonstration. So what you're looking at here is our ACO scorecard. And the reason that I'm starting here is because you can essentially get an entire report card across several different categories for your ACO. You're also going to notice here and here that there are two Medicare Advantage data sets that were brought in just in case you wanted to compare those populations as well. Now that can be either commercial plans, or other Medicare Advantage plans if you so choose. We just have that there just for demonstration. Now you're going to notice everything is represented as a percent change, and that's so that you can compare how your ACO is doing this year compared to the prior year or any two timeframes that you wish. Now, regarding transitional care management, we're going to look down here to the bottom right-hand corner. You're going to see two widgets. We have one titled percent of TCM complete, and one says percent change inpatient readmissions. And you can, again, see both your ACO and Medicare Advantage populations and how they're trending. Percent of TCM complete, that's your TCM completion rate. So how are you as an ACO performing in getting patients in for TCM visits after they've left the inpatient setting? And then percent change inpatient readmissions allows you to gauge if the TCMs that you're doing are lowering your beneficiaries' hospital readmissions at the 30, the 90, and the 180-day marks. Now, because there's typically a correlation between successful TCMs and a lowered 30-day inpatient readmission, you should use both of these widgets in tandem, and that's going to give you a full picture of what's actually going on. I also want to point out, each of these widgets can be changed from a graph view to a more tabular view just with a click of a button if you want to take a look, a closer look at your numbers. We also have a filter panel that appears, and you can use that to look at your information by practice, by provider, or by payer if you so choose. Now I'm going to change over to the post-acute care overview dashboard, which is what you should be seeing here. This is the top widget. You're going to see TCM effectiveness, and that's organized by episode type. Now we have ER here, and we know that you can't do a TCM on patients that have left the ER, but we do have that information there because it's still worthwhile to go ahead and reach out to those patients that were discharged from the ER in order to bring them in for follow-up visits. Now, looking at TCM effectiveness, here you can see the average and the total post-acute care costs. You can also see your 30-day inpatient readmission percentage, which I said earlier, that's the measure that's most impacted by TCMs. We also have a count of how many TCMs have been done, and then we've got a measure of how many discharges have occurred, which is going to tell you the patients that have left the hospital, but they could have had a TCM and ultimately they did not. So when I go ahead and I expand inpatient discharge, so now you can clearly see that the patients that had TCMs have a lower average post-acute care cost than those that did not have TCMs, to the tune of almost $5,000 per patient. And you can also see that 30-day readmissions have decreased by almost 4%. Now, out of the patients that did not have a TCM, I'm going to go ahead and take a look and see if the patient was seen by their primary care provider following an inpatient discharge. And what you're going to see here is if they were seen by their provider, but they didn't have a TCM, those patients had the highest post-acute care cost of all. So finally, I'm going to look down at the bottom two widgets here, post-acute care count of episodes and TCM completed by episode type. And that's going to enable you to see where the bulk of your TCMs are coming from. So in this case, we're looking at the green IP discharge part of the chart. So that's singling that out. All right, I'm going to change my screen back again to our slideshow. because I've given you an overview of how to track the TCMs that you're doing and whether or not they're effective. And what I'm going to do now is dive into some more financials. So I call this the money left on the table slide. And that's because you get to see how much money you're losing by not doing TCMs. So I did all this ahead of time in Salient Interactive Miner, and then I took a screenshot. So what you're looking at are actually two different window panes placed side by side. Your left window pane accounts for both the 99495 and the 99496 TCMs that Stephanie mentioned a little bit earlier, and that's so you can see the average cost of reimbursement for those. And then on the right window pane, I've got a list of beneficiaries that have not had a TCM visit, and then you can see the total number of beneficiaries that have not had a TCM all the way at the bottom. Again, this didn't take a whole lot of time to put together, but it's really just a matter of setting what measures I wanted to look at and then how I wanted to view my data by. After that, it's just a little basic math, and you can see my calculations on the left-hand side in the white space that's underneath the procedure codes, and you can see that the money left on the table range is between about $500,000 and $762,000. And what that tells you, so even if you were on the low end of the spectrum, that's a lot of reimbursement money to give up. And if you're an ACO and you wanted to, say, communicate to your providers, you could communicate how much money's left on the table, but then also how much money was saved by avoiding hospital readmissions, and that would give you a grand total of the amount of money that you're receiving both directly and indirectly. Okay, so aside from the Salient Healthcare dashboards and Salient Interactive Miner, I also want to mention that Salient provides a comprehensive resource library, and you'll find additional TCM initiative documentation and workflows. And you'll also find a copy of this presentation. Our website is www.salienthealthcare.com, and we also have additional literature available on that website if you so choose. Now, up to this point, I've not yet mentioned this, just don't forget, we offer ACOs a free 45-day trial with your own data. We'll even run an assessment for you. So if your organization is looking to implement a TCM initiative, we can certainly help go ahead and get that started. Okay, so what I'm going to do now, I've got a series of questions. So if you have a question for a specific person, just let us know. Otherwise, we'll just assume it's general. I do have a couple that have already come in, and some of them are directives. So this one says, can you talk a little bit more about the process of connecting to the HIEs? They want to know if it's free and how do I sign up? And this, it looks like it's for Maria.
Yep, you'll want to Google to locate your state's HIE. You can register for the event notification system alerts, which are free to receive. And to receive these alerts, the HIE needs to receive an initial upload of all your patients whom you're interested in receiving. And then the update on your patients will be summarized either in an Excel spreadsheet or delivered to you in a secure file that is going to be accessible only by your practice via the internet or through the portal, depending on your state's process.
Great, thanks, Maria. It looks like there's another question here that asks, what happens if I can't reach the patient or the caregiver in that time frame? So I'll take that one. So if two or more separate attempts are made in a timely manner, but they're not successful and the other TCM criteria have been met, in that situation, the TCM service can be reported. Just keep in mind though, Medicare expects the attempts to communicate to continue until they're actually successful. So in that instance, attempts to communicate should continue even after your first two attempts in those required 2 business days up until you actually succeed in making contact. Now, if you make 2 or more separate attempts in a timely manner, and you document that in the patient's medical record, and you're still unsuccessful in making contact, and all of the other TCM criteria are met, at that point, you can go ahead and report the TCM service. So that's really kind of a long way of saying that basically CMS expects the attempts to make contact to continue until you're actually successful. All right, we got one more coming in. It says, May more than one physician report TCM services for the same patient during the 30-day post-discharge period? I'll throw that to Stephanie.
No. So TCM services can only be billed by one individual during that post-discharge period. If more than one physician or a non-physician provider submits a claim for TCM services provided to a client within that 30-day period, Medicare will only pay the first claim as long as it meets the TCM criteria.
Great. And I know we're coming up against time, and it looks like there's a couple of other questions that we want to get to. So what we're going to do is we're going to take those down, and we do have who wrote them. So we'll email you answers. I just know that we had this scheduled for 30 minutes, and I want to go ahead and be cognizant of everybody's time and respectful of everybody's time. So with that, I want to thank everyone for watching this presentation by Salient Healthcare. We look forward to continuing to help you navigate the ever-changing waters of value-based payment initiatives. This last slide is going to be up for a little bit just so you can contact any of our consultants directly if you'd like. And please don't forget to follow us on LinkedIn at the address below for any updates on future webinars and future resources. All right, have a great rest of your afternoon.